Assalamu alaikum. Here is Farah Luqman and I will discuss about the borderline personality disorder. Here are the following contents which we will discuss in this lecture. Borderline personality disorder. First of all, we have to know the meaning of borderline and personality. Personality is made up of different traits or habits. As everyone has different traits or different habits or different characteristics, so they have different nature. On the basis of their different nature, everyone has their own different personalities, which make them different from each other. Even we differentiate people through their personalities. Some are optimists, some are extroverts, some are introverts. But if these personality traits are creating disturbance in their lives, then it will become a disorder. And the second one is borderline, as the word borderline is suggesting the meaning of peak or extreme. The term borderline was brought as a psychiatric terminology when it was used to describe the patients who were on the border of psychosis and neurosis. But later on, it was known as borderline personality disorder. The word borderline in this disorder gives the meaning of extreme emotions or extreme behaviors in any situation. For example, there are some patients of borderline personality disorders. If they care for someone, they care for them on an extreme level. And if they don't like someone, their rudeness is at its peak for them. Even they consider them as their enemy. We can define borderline personality disorder as borderline personality disorder is a mental illness that severely impacts a person's ability to regulate their emotions and which have a negative impact in their daily life functioning and relationship with others. It means that a person with borderline personality disorder cannot control his emotions. This loss of emotional control can increase impulsivity, which affects how a person feels about themselves and others, and negatively impact their relationship with others. People with borderline personality disorders are egocentric. It means that they feel they are okay. They do not need any kind of treatment. They do not feel any kind of guilt. Borderline personality disorder is also known as emotionally unstable personality disorder. It affects a person in following ways: emotional and behavioral instability. It means that people with borderline personality disorder feel difficulty to cope with their disturbed emotions. They have emotional instability. It means they feel little things a lot. Even minor things affect them greatly. For example, if someone refuses to listen to them, they get angry very quickly. And the next one is relationship instability. For example, in any kind of relationship, when someone not treat them according to their expectations or according to their imaginative ways, they thought they are not understanding them. Then they go in intense emotions for the extended period of time. They start weeping, they start to complain. As I discussed earlier, when they love someone, they can do anything for them. They can cross any boundaries for them, which is not normal. And it is harder for them to return to a stable baseline after that emotionally triggered event. This difficulty can lead to impulsivity, poor self-image, which can result in dangerous behaviors such as self-harm. And the next one is unstable self-image. It means that people with borderline personality disorder has distorted and unclear self-images and often feel guilt or shame and see themselves as they are bad. They also dramatically change their self-images because they are unstable in every field of life. For example, if they are student, then they choose any kind of program. After a certain time, they will change their program because they thought it is not a suitable program for them. And same in their friendship, if they choose a friend for them, after a certain time they will change it. In this way, their self-images become unstable because of continuously and constantly changing circumstances, constantly changing their friend groups, constantly changing their relationships, and in this way, they can never develop a sense of self. Signs and symptoms of borderline personality disorder. The symptoms of borderline personality disorder begin in adolescence or early adulthood and continue over many years. When they left untreated, they can cause great distress. Even all types of personality disorder cannot be diagnosed before the age of 18. Here are the following symptoms of borderline personality disorder. Affective symptoms, which include fear of abandonment. It means that fear of being left alone. People with borderline personality disorder are often terrified of being left alone. Even something as innocuous, for example, as a loved one arriving home late from the work or going away for the weekend, may trigger intense fear. This can lead to prompt frantic efforts to keep that person close. They may beg, start fights, track their loved one's movements, or even physically block the person from leaving. But unfortunately, this behavior tend to have the opposite effects, which may be driving others away. And the others are emotionally instability and mood swings. Unstable emotions and mood swings are common in borderline personality disorder. One moment you may feel happy, and the very next moment you may feel sad. Little things that other people brush off can send you into emotional tailspins. These mood swings are intense but usually last for just a few minutes or hours. And the next one is feeling empty. People with borderline personality disorder often talk about feeling empty, as if there is a hole or void inside them. At the extreme, they may feel as if they are nothing or nobody. This feeling is uncomfortable, so they may try to fill the void with things like drugs, food, or sex, but nothing feels truly satisfying. The other symptoms of borderline personality disorder include behavioral symptoms. In behavioral symptoms, we will discuss about the self-harming. Borderline personality disorder is self-harming. People have suicidal thoughts, suicidal behaviors. Suicidal behavior and deliberate self-harm is common in borderline personality disorder. Suicidal behavior include thinking about suicide, making suicidal gestures or threats, or actually carrying out a suicidal attempt. It includes all other attempts to harm yourself. Common forms of harming yourselves are cutting and burning. And the others are in behavioral symptoms are explosive and unstable. And the other type of borderline personality disorder symptom is cognitive symptoms. In cognitive symptom, we will talk about paranoia. People with borderline personality disorder often struggle with paranoia or suspicious thoughts about other motives. When under stress, they may even lose touch with reality, which is also known as dissociation. For example, they may feel spaced out or they may feel they are outside of their own body. And the other cognitive symptom is loss of identity. When you have borderline personality disorder, your sense of self is typically unstable. Sometimes you feel good about yourself, but other times you hate yourself or even view yourself as evil. You probably don't have a clear image or idea of who you are or what you are want in your life. As a result, you may frequently change jobs, friends, loves, relation, values, goals, or even sexual identity. Causes and risk factors of BPD. Causes of BPD are still unknown, but here are the following risk factors of BPD, which include genetics. It means that it runs in families. Studies has shown that BPD runs in families. If you have a family history of BPD, you are more likely to have it, but no guarantee to develop the condition. The other risk factors of BPD include brain abnormalities. Brain abnormalities include chemical instability and communication problems in brain parts. In people with borderline personality disorder, the part of their brain that control emotions and behaviors do not communicate properly. These problems affect the way their brain functions. Some research has shown that there are some changes in certain areas of brain involved in emotional regulation, impulsivity, and aggression. In addition, in certain brain chemicals that help regulate mood, such as serotonin, may not function properly. The other risk factors of BPD, which include childhood experiences or stressful childhood, which include sexual or physical abuse, separation from loved ones, losing someone's importance. Many people with this borderline personality disorder report being sexually or physically abused. Some people have lost or were separated from their parents or close caregivers when they were young. Others have reported that they were exposed to unstable family relationships. Treatment for borderline personality disorder includes psychotherapy. Psychotherapy, also known as talk therapy. The ultimate goals of psychotherapy are to help you in the following ways, which include: the first one is focus on your current ability to function. The second one is learn to manage emotions that feel uncomfortable. And the third one is reduce your impulsiveness by helping you observe feelings rather than acting on them. And the fourth one is work on improving relationships by being aware of your feelings and those of others. The types of psychotherapy which can be helpful for BPD are DPT, MPT, schema based therapy, and the TFP. The other treatment for BPD is medication, which include antidepressants, antipsychotics, mood stabilizing drugs. And the third one is hospitalization. Hospitalization may also keep you safe from self injuries or address suicidal thoughts or behaviors. And these people are considered as pampered or unstable in their society. They are not pampered, they are not unstable persons, but they have some personality disorder which is called borderline personality disorder. So, if there is a person in your surroundings who is suffering from these problems, then must consider the professional help. So, they may start coming toward a progressive life.